Okay, sounds good, Greg. Thanks so much. Hi, everybody. Happy Wednesday. Hope you're having a great day. Hope it's been a good week. And I want to welcome all of you to today's meeting and call to order the sixth meeting of our Family Caregiver Advisory Council. Again, so grateful for the fellow council members and our colleagues at the National Academy for State Health Policy and so many other amazing partners in this work. And I extend to you my very warm welcome and again, gratitude that you are joining us today. Thank you so very much. And of course, I also want to acknowledge the members of the public who are with us today. Certainly, I've been pleased, like all of you, to see the level of interest in these meetings and in the work that we're doing. And I want you to know that we certainly, as public members, really value your comments and your input throughout the meeting. So thank you. And again, keep that information coming to us. We are just so excited about today's meeting. And again, there's just a lot that we're going to talk about. We, excuse me, we're really, I think, in a position to be very proud of all that we've accomplished. And I want to start off and just recognize or acknowledge, if you will, that we're celebrating National Family Caregivers Month for the month of November. So, of course, it is very timely that we're holding a meeting of the Family Caregiver Advisory Council during this month as well. And looking at our agenda, and as I've been briefed by my team here at ACL, Greg, Lori, Sarah, and others, I just want to point out the importance of this event. As you'll see when Greg goes over the agenda here in just a couple of minutes, today's meeting really will see this council vote to adopt a slate of recommendations for inclusion in the initial report to Congress. That is so very exciting, and it's really an incredible marker of the progress of our work. So as you know, when we first met back in August of 2019, which just seems like yesterday, I shared with you my passion for this work and how improving supports for family caregivers has been so central to my work here at ACL. As I look back on our work and all the progress we've made, I can't help but be extraordinarily thankful for the progress we've made. And of course, we are today at a pivotal point, and the direction that we're heading with our work is just outstanding. Our success so far, of course, would not be possible without the incredible talent and dedication of the members of this council. What an incredible group of individuals you are. And again, we're just so honored to work with you and walk alongside you in this journey. Your commitment to improving the lives of family caregivers is remarkable. Each time we've gathered together like this, I'm so struck by your creativity and drive to do what's best and what's right for millions of family caregivers in our country. As I think a bit more, I'm also deeply grateful for the collaborative efforts of our many partners in this effort. First and foremost, the John A. Hartford Foundation's foresight and generosity that enabled our colleagues at the National Academy for State Health Policy to take a key role in helping ACL move ahead with this work. Without that partnership, I dare say we would not be where we are today and in a position to advance a slate of recommendations so quickly. Among our other partners in this work, of course, has been the National Alliance for Caregiving, who you'll be hearing from here just a little bit on the agenda. And they've done such an amazing job of helping us infuse the voices of family caregivers into our work and our focus. And also, we've been so fortunate to have the expertise of Community Catalyst, UMass Boston, and Advancing States. All three have helped us really understand and make meaningful use of the information that we've gathered through listening sessions of family caregivers and, of course, our request for information efforts. Your work has really been so integral in ensuring the voices of family caregivers are also present in our work. But I guess if there's one thing I'm most grateful for in all of this work is, of course, the honor that we have to help support the 50 million family caregivers across this country, who we know day in and day out give all that they can to support those they love and help them remain independent and in their homes and communities. And when you're the administrator for the Administration for Community Living, that really hits the bullseye. I don't think our work could be more important than it is around these conversations. So family caregivers are who we work for and on behalf of. Family caregivers are the cornerstone of our long-term services systems, and they are the heart and soul of our nation and a true representation of the very best in all of us. Supporting families and family caregivers, of course, is at the heart of our mission here at ACL and our vision. That makes the work that we're doing here all the more important and meaningful. So with that, I'm going to go ahead and just turn the agenda over to Cheryl Thompson, who, of course, is going to take roll call, and we'll proceed on with the meeting. So, again, thank you so very much to all of you, both council members and the public who are participating today. And to Greg and the team, just keep doing the great work that you're doing. I'm so proud of all of you. Cheryl, the floor is yours.
Thank you very much. And we'll start off with our chair, Lance Robertson.
I am present. Thank you.
And then our co-chairs, Casey Shillum.
Present.
Alan Stevens.
Present.
Nancy Murray.
Present.
And then our non-federal members, Ben Bledsoe.
Present.
Joe Caldwell.
Present.
Diane Caradu.
Present.
James Cheeley. Gisela Dolan. Brenda Gallant.
Here.
Catherine Alicia Georges.
Here.
Rhonda Montgomery.
Here.
James Murtha.
Here.
Deborah Stone Walls.
Here.
Teresa Tanus.
Here.
Thank you. Carol Zernial.
Here.
And then our federal members. Elizabeth Darling is not able to attend, but we have an alternate, Liliana Hernandez. Dr. Linda Davis.
Here.
Bruce Fink.
Present.
Melissa Gerald. Melissa Harris. Or alternate, Jody Sumaraki. Helen Lamont.
I'm present.
Thank you. Tamara Mays. Lisa McGuire is unable to attend, but we have alternate Dr. Christopher Taylor.
And Cheryl, I'm here. This is Melissa Gerald. I was muted, I just realized.
Oh, no problem. Thank you very much.
You're welcome.
Okay, Dr. Christopher Taylor. Jan Newsom. Katie O'Callahan, or alternate Diane Mitchell. Lisa Schifferly.
Here.
Thank you. Rosemary Payne is unable to attend today. Mark Vafiades. And Joan Weiss.
Cheryl, this is Chris Taylor from CDC. I am present.
Okay, thank you very much.
Thank you.
And did any members join after I began roll call? Okay, thank you very much, and I'll turn it over to you, Greg.
Great, thank you, Cheryl. And let me also extend my welcome to the members of the Family Caregiving Advisory Council, as well as those members of the public that we have tuning in to watch the meeting today. Before we get started, I want to just run through the agenda today. It is a very accomplishment-packed agenda. This meeting, as Lance alluded to, will be rather pivotal in the history of the Family Caregiving Advisory Council, in that we are going to be voting, you all are going to be voting to adopt a slate of recommendations that will be included in your initial report to Congress. And we'll talk a little bit more about that later on. But before we get to that, one item that we do have is a presentation from our partners at the National Alliance for Caregiving. One of the goals of ACL, as well as the Family Caregiving Advisory Council, from the very beginning has been to ensure that we are honoring and including the voices of family caregivers in the work that we do and in every step of our way towards the development of a national caregiving strategy. And through the support of the John A. Hartford Foundation and their grant to the National Academy for State Health Policy, they were able to engage with the National Alliance for Caregiving to actually bring the voices of caregivers to the forefront through a series of interviews and the development of a series of family caregiver stories. And Mike Whitkey is going to be here to talk with us about that effort. And then right after that, we are going to then move into the business portion of our meeting, which will really take up the vast majority of today's meeting, which will be the presentation and voting by the non-federal members of the council to adopt a slate of recommendations for the 5 goals that they adopted earlier this year. And then at the end of the meeting today, we're going to be going over our ACL and NASHP's immediate plans for the work of the council that will get us through approximately March of 2021. So by way of just providing a little bit of an update on ACL and what we have going on here, since our last full meeting, we've not been idle. We have been incredibly busy. I can tell folks that the work on the initial report to Congress continues, and it's moving along quite well. Many thanks again to our federal partners for your very close collaboration and cooperation with my staff in completing the inventory of federal programs and initiatives. I know that there are still a few outstanding documents that you all are reviewing, but that process has come along quite nicely, and I think the information that we'll be able to pull together on the federal level for this report will be quite impressive. So thank you to those of you who have completed your review of your narrative portions, and in advance thank you to the rest of you who are working to get those to us. Sarah Markell from my team continues to be very active in her role as the lead writer. And we are going to begin moving sections of this report through some internal review here at ACL, and then ultimately to our council in the coming weeks. Other activities that we have going on, of course, November is National Family Caregivers Month. ACL has been working closely with the National Alliance for Caregiving to promote their tweeting and presenting of a select group of their caregiver stories that will be featured in our report, and you'll see a little bit more about that in just a minute. Early next week, Lance will be publishing a blog for Caregivers Month, which I think will feature a lot of our work that we've done so far on the council, and so keep your eyes open for that. That's pretty much what we've have going on here related to updates. Wendy, at NASHP, did you have anything in particular that you wanted to add to the updates?
Sure, just 3 also quick updates. One is the listening sessions. So Community Catalyst, our partner, will be hosting listening sessions during the first 2 weeks of December with organizations to give you input on a national strategy. So council members, if you can, please RSVP if you plan to listen in. I know we've heard from a number of you, so this is just a very friendly reminder for those of you who we haven't heard from yet. The second update is that my organization, NASHP, just published a paper called Medicaid Supports for Family Caregivers, which will also inform this report to Congress. So council members and the public who's listening in right now, please read this important paper. And once again, it's NASHP's paper entitled Medicaid Supports for Family Caregivers. And then finally, for National Family Caregivers Month, my organization, NASHP, will be hosting a Twitter chat tomorrow, 2 p.m. Eastern time. So please join us, including the public. Please join us, and you'll use hashtag #RaiseChat to raise awareness and discussion on family caregiving. And with that, back to you, Greg.
Great. Thank you, Wendy. So definitely lots going on for Family Caregivers Month. I think it's particularly exciting this month given the progress that we've made with you all as the Family Caregiving Advisory Council, and we just really appreciate the momentum. Before we move into the main portion of the agenda and we hear from Mike Whitkey at the National Alliance for Caregiving, are there any do many members of the council have any questions or comments or updates that they would like to provide? Okay, well, hearing none, then we will go ahead and move to the next portion of our agenda. Many of you may know Mike Whitkey. He's the Senior Director for Public Policy and Advocacy at the National Alliance for Caregiving. NASHP and ACL engaged with them with NAC several months ago to look at the possibility of really bringing the voice of caregivers to the forefront in a very real and meaningful way. And then presenting those voices and those stories and perspectives in the initial report to Congress that's developing. And so it's really fitting, I think, for Family Caregivers Month to be able to have Mike talk about their work and to begin to just show you some of what will be presented in this report. But I think it's also a wonderful way to really honor caregivers this month in a real and meaningful way. So Mike, I'm going to turn it over to you to take council members through the work that you all have done and present us with some of the great outcomes of that. Mike?
Thank you, Greg and Wendy and everybody for having me here today. It's an honor and a pleasure to represent the National Alliance for Caregiving. Again, and if you want to move to the next slide, we can get started here. So my role, my name is Mike Whitkey. I'm the Senior Director for Public Policy and Advocacy at the National Alliance for Caregiving. So I work a lot with policymakers here in DC and around the country. And we also have a grassroots network of caregivers who are, well, caregivers and people who work with caregivers from all over the country, from different states and localities. And that's really how we were able to draw from our network to bring some caregiver voices into this project. So what I'm here to do today is to shed some light on the work that we at National Alliance for Caregiving have been doing to bring the caregiver voice into the work of the RAISE Council through a series of vignettes highlighting the lived experiences of caregivers across the United States. You can go to the next slide. So just a little bit about our organization. I'm sure many of you are familiar, but I wanted to just sum it up through our mission and our vision, which we live every day. You can see it here on the screen, and the work that the RAISE Council is doing is perfectly in line with NAC's vision to offer that offers a roadmap to see how we can create a society that recognizes, assists, includes, supports, and engages family caregivers in various aspects where they're impacted by their role as caregiver. And we also see this work in line with our mission to partner with stakeholders such as ACL and the RAISE Council and the National Academy for State Health Policy and John A. Hartford Foundation, for example, to reach into our network and engage the very group we're all working to address through this work and through other work that you are all involved in. You can go to the next slide. So my goal here today in this presentation is to tell you a little bit about this project and how we went about collecting the details that went in each of these caregiver vignettes. And then we'll have a chance to get a glimpse of some of the caregivers that we featured and how this work will evolve into 2021. You can go to the next slide. So first, as we set out to collect these stories, we wanted to make sure that the caregivers featured reflected the wide diversity of caregivers, including backgrounds that represented racial and ethnic, gender diversity, as well as various age ranges of caregivers, those who are from rural and urban areas and all in between, in addition to caregivers of people with various conditions. So many different types of lived experiences and so many different types of caregivers who, you know, we want to draw out through the course of this project so that people really get a sense of the various types of caregivers that are out there. So Next, we drew from a selection of caregivers in our network to do some, and who we knew actually had some level of knowledge about the policy and advocacy landscape so that they could speak to an audience of policymakers. Not everybody has that sort of perspective and understanding. Some of them are caregivers who didn't even realize that the work of the Raise Council was happening, but some of them actually have had a chance to be involved in advocacy through organizations that represent mostly the conditions of the person they're caring for, such as the Alzheimer's Association, the ARC, and the different aging, disability, and beyond organizations that are working to serve. They're also playing in a role into drawing out the needs and pay some attention to the ways that we can bring caregivers into the healthcare system and support them through their financial security challenges and beyond. A lot of the things that you guys are all talking about in your recommendations. And so similar to an experience we're all familiar with, COVID-19 came into our lives during the course of this project, so we had to adjust to a virtual world. We were originally planning to make sure that all these caregivers had an opportunity to get high quality, high resolution photos that can be included along with their stories to be included in the first report. And so those caregivers who did not have a ready-made high quality photo that could be used, we had planned on sending photographers to their houses so that we can get some good quality photos. Obviously, the population that we're talking about here today is the most vulnerable out there to the virus. So we were not comfortable at that point sending any photographers into any people's homes to try and help prevent the spread of the virus. So we had to get a little bit creative, and that's where Zoom came into our lives. We interviewed caregivers through the virtual network that allowed us to not only be able to record their stories and to record the interview that we did with them, so we're able to draw from that interview to be able to collect the stories and to collect the details and make sure that we were representing their stories accurately, but also we were able to capture some still photos throughout the course of the interview that we could turn into some high resolution, high quality photos that will be featured in the report. It will also, in and of itself, reflect the world that we're all living in right now during this pandemic, with everybody being isolated in their homes. So we interviewed caregivers to summarize their stories, and we needed to make sure that we fit those stories within a framework that fit within this report. So, we just sort of took some of the snippets and the highlights of the different unique aspects to each caregiver that, a lot of them have the caregivers have similarities in their stories, but we wanted to make sure that we were highlighting what was unique about each individual story in the summary that ultimately worked out to be the vignettes. And we also worked within a network of policy leaders to give them a heads up that this report is coming out and will feature caregivers of the populations they represent and they're working to serve. So as a way to raise the awareness of the work that's going to be coming out for this first report and to draw attention to the recommendations that are going to be produced along with it. And lastly, we featured 5 of those highlighted through a social media. The 5 caregivers that we featured throughout this whole process are highlighted in the month of National Family Caregiver Month through a social media campaign that's currently taking place. We all sort of heard from the beginning of the conversation here today that this is a perfect time of the year to be able to start highlighting some of those stories and to draw attention to the work of the Raise Council through a social media campaign. And I'd just like to say a big thank you and acknowledgement to those who made this work possible, working with ACL, the Raise Council, NASHB, and Johnny Hartford Foundation especially. We've all worked really closely together to make sure that the work that we were doing here, collecting these stories and these vignettes, fit within what could really be helpful and useful for the Raise Council in highlighting the recommendations and supporting them as they are published in the first report. So you can go to the next slide. So this is the sort of image that I pulled together that represents the National Alliance for Caregiving's network. A lot of these caregivers were drawn from our advocacy collaborative. So we have, like I said earlier, several caregivers and several professional folks who are working with caregivers across the country. And so we were able to really get a good cross-section of caregivers, sort of meeting all the different criteria we were looking for, to be able to make sure we weren't just telling the same story over and over, but we had various and unique and a diverse range of stories that could be told. So that's a little bit about how we were able to go about the process of grabbing those who we were going to be able to feature and we were going to be able to interview during this process. You can go to the next slide. So for each caregiver that we interviewed, some of the questions were a little bit different, but we kind of followed a similar theme that you can see here on the bullet points here. We started by asking a little bit about the person, the care recipient, the person that the caregiver was caring for, what kind of condition that they had, what types of care that they required, how long they've needed care for, all those kinds of different details to really get a good understanding of who they were caring for. But then we also turned the questions over to learn a little bit more about the caregiver. What's their lived experience? What kind of, how has their life changed as a result of the caregiving experience? What kinds of challenges and hurdles they experience during this process? And then we asked them what would have helped if they had a more robust infrastructure of support around them, to really get a good sense of what, from a lay perspective, what would have been helpful to them, not only in supporting them in their role, but also for those that they're caring for. And lastly, we wanted to ask them, very targeted and specifically, what do you think policymakers and society should know about your experience? How would you, if you were sitting, a lot of the times we frame the question, if you were sitting in front of a member of Congress, the person that was elected to represent you, and they asked you what they should know about your experience, what would you tell them? A really interesting process to go through. And a lot of them had really great insight to be able to bring towards this process. A lot of them were able to get very specific in their answers, and some of them really had no idea that people were even looking to try and create such a framework, and they were very pleased to see that people were asking them about what it is that they needed, and to better support them in this role. You can go to the next slide. So this gives you a snapshot of those caregivers that we interviewed throughout this process. Again, really trying to reflect a broad diversity of caregivers that we know exist across the country. Males, females, people from different cultural backgrounds, people who are living out in rural parts of the country where supports aren't very robust, people who are living in more urban parts of the country where there actually are some supports, but maybe there could be some improvement. And when we captured these images, we had them professionally designed to go along with the brand colors and the brand imaging that went along with the Raise Council's logo. So you can see that blue and the stars that are reflected in the name banner there, so that this can really go in nicely to the report and look professional. We just took their first names so we can establish a level of anonymity for those caregivers, to respect those boundaries. We didn't actually provide any personal details other than the first name of the caregiver alone. We were contemplating changing their names, but some of them felt like that was a little bit odd, and they were happy with just keeping their first name included. And so we also put under their first name the location of where they're from, so that you can get a sense of really how that this is a representative group from across the country. The other thing that we wanted to do as we were capturing these videos was sort of get a mixture of some of these pictures, get a mixture of some caregivers who were, kind of just providing a smile, as if we were to take a photo of them. But some of the pictures also were to reflect them in the process of telling their story. So you kind of get a mixture there between some of those caregivers who were sort of mid-sentence expressing the emotion they were feeling, and then some of the caregivers who had some points within the photos, within the videos that we collected for this or through this interview process, that showed them kind of smiling and looking nice. You can go to the next slide. So these are the rest of the caregivers that we interviewed. It was, I believe, 27 in total that we ended up getting altogether. We were starting the process to collect about 10 to 20, and once we got to about 20, we realized that we had so many different types of stories that and caregivers that came back to us that weren't already reflected in the original amount of stories we collected. So we expanded it to make sure that we had, a broad range of caregivers and experiences. As I look at these pictures, I'm reflecting on, how each one of these interviews were incredibly powerful. When you start to ask them about the experience they're going through, they're really eager to talk about how this has had an impact on their life. And also there was a lot of expression of joy and happiness, that people were very encouraged that they were able to be there for their family members. As challenging as the experience was, there really was a bit of humor and liveliness that came through in a lot of these interviews. And it was just such a great experience to be able to go through and talk to these people one-on-one individually. And so you can go to the next slide here. This is a picture of the various caregivers that we featured and are featuring throughout National Family Caregiver Month. We had their pictures, again, sort of professionally designed within a graphic that took a quote from their story to, let them speak through their own words. We produced about 15 in total. So we shared 5 throughout this month, and we have 10 more ready to go that we can share as a way to highlight when the report comes out, and to be able to keep the conversation going throughout next year. The other part about the collecting these vignettes and these stories and these quotes is that each of these interviews lasted about 30 minutes in length. So we really were able to get a lot of different types of information that help kind of tell this story in a nuanced way. Not only does do the social media posts that come out go with, are we highlighting these photos and these quotes, but we also have little snippets that of language that actually came from the vignettes that people are able to share with the social media posts that they are promoting throughout the month. So you can go to the next slide. So this work we plan to take into next year by hosting the full vignettes onto the National Alliance for Caregiving and the National Academy for State Health Policy website through the resource and dissemination page for the RAISE Council, because I'm sure that as the final wording is pared down to be able to fit within this large report that's going to be coming out, that there may be just a shorter version of the vignettes that we ultimately drafted to go along with this published document. But we wanted to have a place for people to be able to go, to be able to read the whole story, to be able to get the responses to all the different questions that we asked, and to be able to look a little bit more into the insights that were provided if they're so interested in doing so. And we also throughout this process are making sure that, and we're going to continue to do so throughout next year, that each of these vignettes connects to the RAISE Council recommendations. So when we have a unique aspect of one caregiver story that really highlights one of the specific recommendations that you all have highlighted, we can say, here is this caregiver, here's their experience, and this specific recommendation or these set of recommendations would really speak to a way that can support them and address the concerns and needs that they have brought up during our process of collecting their stories. And also, as I mentioned, as we started the interviews, we weren't really sure exactly how the caregivers were going to, respond to some of the questions. We actually ended up, we expected that each of the interviews would only take about 15 minutes, but once you got them going, once you really started to get a rapport built with the caregivers and ask them about themselves, they really had a lot to say. So each of the interviews ended up being, like I said, about 30 minutes long. So we felt like it was a really great opportunity, since we recorded all of them, to be able to not only have the videos and have the vignettes that were sort of parsed down into a smaller word count, but take each of the caregivers, the videos that we collected, and edit them down in a way that we can actually share these videos, as a part of disseminating the work of the RAISE Council and beyond, into like 1 to 2 minutes length clips that can be shared on social media, for example. We can really get kind of creative in terms of how we're able to bring their story and their voice to life by having them tell their own story in a way that's kind of a little bit more fast paced, that's professionally edited, that includes a little bit of B-roll and some narration, and allows for the dots to be connected so that you're not having to sit down and watch a full 30-minute video where you kind of get the ums and the uhs and the things like that taken out. And we're also going to do sort of like a longer compilation that will probably be about 5 to 7 minutes long, that really tells the collective story of these caregivers, and we'll be able to use that video for any sort of activities that we do to promote the recommendations with policymakers. And that's one of the things that we plan to do next year, is when the report is ready to come out and the recommendations are available, that we get these recommendations and the whole body of work that you all have done in front of policymakers, so that they can not only be aware of this work, but also get a good understanding of the roadmap of how we're trying to reach a society that recognizes and values them and includes them a little bit more than currently is happening. And we're going to do a couple of listening sessions also where we draw from some of the caregivers that we interviewed throughout this process and have them react to some of the recommendations, to speak a little bit more in detail about how the work that this council is doing is reflective and can really help make life better for not only them if they happen to be in the caregiving experience still, but also caregivers into the future. One of the caregivers that we interviewed throughout this process, it's a dynamic experience. One of the caregivers who was caring for his wife passed away during the experience. And so, it really highlights the dynamic and the ongoing and lived experience that these caregivers are not in a static state, that they're really going through something that evolves and changes over time. And so we want to make sure that we're able to bring their voice as much as we can into the work that you're doing, and also share it with those who will be responsible for implementing the good work that has come out of this whole process. So you can go to the next slide. So that's really a summary of the process that we went through, an example of the caregivers that we were able to feature throughout this process. We look forward to hearing any sort of feedback from all of you as you get a chance to look through the vignettes, as you get a chance to vote and finalize on your recommendations that you'll be doing here in the next little while, I'm sure. And we look forward to continue to work with you throughout as this process evolves into the new year. So thank you for having me today. I'm happy to answer any questions, and take care.
Thank you very much, Mike. Council members, any comments or questions for Mike Whitkey?
It's just amazing work.
James, yeah, we can't hear you.
Yeah, I just wanted to commend you, Mike. It's amazing work.
Thank you. I appreciate that. It was very powerful, and it was an honor to do it.
Hi, this is Deborah from Maui, Hawaii. Thank you, Mike. Yeah, I was very impressed with your intentions and capturing people in the various phases of caregiving. I think it's going to be very effective. So thank you for your work.
I appreciate that, and thank you for your work too.
Thank you, Mike. One of the very interesting things that happened when Mike shared just the printed versions of the draft vignettes, as Wendy and Sarah Markell and I began to go over them and read through the amazing material, we very, very quickly began to see how, without the caregivers knowing the recommendations that you all are going to be considering and voting on today, most, if not all, of these vignettes speak to one or more of these recommendations. And so I say that to say that I think their experiences validate and will confirm the recommendations that you all are voting to put forward today. And they're so beautifully connected. And it's also was interesting to see that, that for many of these caregivers, many of these different areas that you all are thinking about apply to them. So it is truly a multifaceted experience for family caregivers, as we all know. So Mike, thank you again so much. It's been great working with you, and we look forward to continuing to work with you guys, not only for the rest of Caregivers Month, but as we move into next year and we get this report out.
Yeah, I'm looking forward to continuing to work with you all as well. This is great work that you're doing. Thank you again for all the time and effort you all have put into this process. I know it's not easy to try and take very personal lived experiences and translate it into a document that would be able to speak to a challenging policy landscape that we're all going through and have been. And I think that this is going to be a tremendous effort in helping further establish and cement the roadmap that allows us to really express and highlight the various ways that we're able to address some of these challenges in real concrete ways. So thank you again, and I appreciate being here today.
Great. So thank you. So we're a little bit ahead of schedule, and that's great because we have a lot to cover. And so we're going to move on to the next portion of our agenda, which is the council's presentation of the recommendations and your votes to adopt them. But before we get to that, I just want to provide a little bit of context and reminder for our council members, but also we have about 112 members of the public tuned in to watch. So I just want to kind of ground the next hour and a half or so in a little bit of history and context. So for the council members, over the past several months, you all have been working both in public meetings like this of the full council as well as your subcommittees. You've been working diligently to craft a set of recommendations that would be moved forward and ultimately serve as the basis for the National Caregiving Strategy. And each of these recommendations that you all are going to be presenting and considering today have been through multiple iterations and revisions over the course of your work. And really, we think that at this point, what you all will be presenting and discussing today reflects the council's best thinking over these past months of deliberation and analysis of the information that you all have collected from a variety of resources. Many of those opportunities have come from presentations at full meetings like this. But I first want to remind everyone, and that includes the council members, but also those of you in the public, of just a few key things to keep in mind as we go through this portion of our agenda. So first is that the recommendations that you will hopefully adopt today are likely just the first in a series of recommendations that are going to grow and evolve over time over the months and years to come. In other words, while these might be the first set of recommendations that this council adopts, they will by no means be the last. And more importantly, these recommendations that will be presented today are intentionally broad. They can speak to a whole host of possible actions and steps and opportunities for real progress in a number of areas, both on a very minute scale, but also gives you as the council the opportunity to think as big as you want in the development of the National Caregiving Strategy. So the specific actions or steps that will be undertaken or proposed under each of these, whether it's going to be at the federal or the state level or by health and long-term services providers, that process is going to come later next year when we begin building the national strategy. So for today, our work will focus just on adopting these recommendations. And further, I also want council members to recognize that once this report goes into clearance next year, that some of the language that we have today may get tweaked a little bit as it goes through vetting and review. And to that end, I just ask that the discussion today be viewed as the beginning of a dialogue in this regard and by no means a conclusion. Our approach that we're going to use today and that we've gone over with the council co-chairs will be to have each of the council co-chairs, so that's Dr. Alan Stevens, Nancy Murray, and Dr. Casey Shillham, introduce the goal or the priority area, after which our subcommittee leads, and our subcommittees are headed by James Murtha, James Cheeley, Carol Zernial, and Dr. Georges, will present the slate of recommendations under each goal. And there's as few as 3 or 4 on up to about 9 or 10 under each of the goals. Once all of the recommendations under the particular goal are read, we'll have some time for final discussion and review. Given the extensive amount of work that has occurred up to this point, though, we really don't anticipate that there would be much in the way of revisions or edits to be made at this point. And we're going to work one goal at a time, taking a vote after each set of recommendations. And just remember that the voting process is for our non-federal partners only. And so we've allotted about 20 to 30 minutes for each goal. We're going to take a break after goal 2, I think it is. And Sarah Markell will be our timekeeper. So council members, any questions before we begin? Okay, hearing none, I'm going to go ahead and begin to turn things over to our council co-chairs and subcommittee leads to take us through each of the goals and present the council's recommendations under each. So we're going to start with goal 1. And Nancy Murray, you're one of the co-chairs, and James Murtha and Carol Zernial are co-subcommittee leads for this particular goal. So Nancy, take it away.
Thanks, Greg. I just wanted to say that I am a family caregiver. My husband and I have 2 adult children with Down syndrome. So this means a lot to me, both personally and professionally. And I think it is only fitting that we are going to be approving these recommendations during National Family Caregiver Month. So let's get started. Our first priority area is creating more awareness and outreach for family caregivers. And our first goal, family caregivers, physical, emotional, and financial well-being can be improved as a result of expanded awareness, outreach, and education. And again, as a family member, I can tell you that this is something that all family members across the United States continually need. The need for information and education never stops. So Carol or James, do you want to start off with our first recommendation?
Yeah, I'll begin. And everyone listening, I'm James Murtha, one of the leads for Subcommittee 1. And I just tell you a little bit about myself. I have a disability from becoming paralyzed after a mountain biking accident. So I receive care, and so that's my perspective where I'm coming in from to the council. So to begin, recommendation 1.1, increase public awareness and recognition of the diverse needs, issues, and challenges family caregivers face, and of the importance of recognizing and supporting them.
Thank you, James.
Yep, and Carol, you can take one too.
Thank you. I'm Carol Zernial, and I'm pleased to serve on Committee 1. And I run a foundation that serves caregivers, as well as being a family caregiver for my mother, who recently passed away with Alzheimer's. So recommendation 1.2 speaks to the challenge of having caregivers recognize their role, increase family caregivers' self-identification, and access to information, services, supports across a range of topics.
And 1.3, improve outreach efforts to family caregivers to ensure early identification and access to services and supports. Next slide, please.
1.4, support the development or revision of state, territorial, tribal, and local planning that focuses specifically on recognizing, including, and supporting family caregivers of all ages and is aligned with the National Family Caregiving Strategy.
And 1.5, promote the expansion and role of public and private partnerships at all levels that recognize, assist, include, support, and engage family caregivers.
So now I would ask all of the council members, now that you've heard all of the recommendations again, is there anything significant missing from any of these recommendations? We'd also like to add that all of the recommendations that you're going to hear this afternoon, they're all important. They're all priority recommendations. No one is more important than anyone else. But this is your opportunity. Or did we miss anything when it comes to more education and outreach for family caregivers? If not, then I would say we did a good job. Greg, I don't hear any further ideas.
Okay, well then I think we could do, Chantal, if you could advance to the next slide. So for the non-federal council members, if you want to, we're going to pull up a poll for the non-federal council members to vote. And the vote is, the vote reads, I vote to adopt recommendations under Goal 1 as presented, and you select either yes or no. And we'll give it just a minute or so that we can register all of the votes of the non-federal members. And then we'll take a look at the results. So Cheryl, whenever you think you've captured all the votes. Okay, it looks like we have.
Is there a way to reopen the polling? The time said it was off before I got a chance to vote.
Oh, Cheryl, can you reopen that?
Sure.
And this is only for the non-federal members of the council, only the non-federal members to vote.
And Greg, how many non-federal members are on the call today?
All 15 are here today.
Okay. So if all 15 vote yes, then we should see a 15 there.
Yes, right now we have 18, so it looks like a
That's
couple
why I'm asking.
Okay, I will restart it and I will ask that all non-federal members only take the poll. Thank you.
I can't see the poll.
It's in the chat polling box off to the right.
I can't. God, I can't see it.
It's not quite there yet, Carol. I don't see it yet either.
Okay.
It's not there yet. Hold on.
She's resetting it. This is Lori.
Thank you. Thank you. Sorry, I can't see it.
It went away.
Well, while we're waiting, Carol and James and I really appreciated everybody who worked on this one priority area and all the hard work and the good discussions that we had.
Yeah, I have to say, listening into your discussions and your deliberations, it was really heartening to hear the robustness of the discussion and the thoughtfulness that went into these, really for all of these.
Yeah, I second that.
And thank you all for taking on leading the subcommittee. This has been.
Okay, here's the revote on Goal 1.
Okay, we'll do a better job this time.
And can you walk, the answer just goes into the chat box? I'm sorry, I'm not seeing a yet. Approve, not approve. Sorry. And then it's,
Yeah, this is Lori. In the lower right by your chat box, there's 3 little dots. Click on those little dots and you'll see the word polling. And that will bring the poll up for you to respond to if it's not.
thank you. Mine says the poll has ended, and I'm not sure. I apologize. I'm just not seeing the buttons.
Did you see it in the dots?
It says poll, it says polling, and then when I pull up polling, it opens and it says time lapsed and the poll has ended.
Cheryl, have you closed the poll? I don't think it's closed.
It says the poll has ended.
I will put it up again so that you
Mine also says the poll is ended, and I'm usually the slow one, Carol. So
Thank you, James. You're making me feel better. Like every time I open it, it says the poll is ended. Aha, now I see a question. Thank you. That's perfect. Thank you so much.
I am showing that 14 people have finished and 1 is in progress.
Well, that's our 15. Plus, we had enough votes for the first 2 practice rounds.
Yes, we did.
We have 45 now.
I think we're well.
Right. We have
Thank
at least
you.
40 votes.
Thank you. And I did close earlier because I saw more than 15 people had voted. So now I see 16 have voted. So I am closing the poll now.
Okay, so it looks like that you all have voted to adopt the recommendations under Goal 1. So that is 1 down and 4 to go. So thank you, and we'll get the hang of this as we keep moving. So we're going to move on to priority area goal number 2. And for that, I'm going to ask Dr. Schillem, one of our other co-chairs, and Dr. Georges to take us through that goal and then the recommendations under that.
Thank you, Greg. Hello, everyone. I am Casey Schillem, and I have multiple reasons for being involved in family caregiving work. My practice has been in the care of older adults in home health and chronic care management for older adults in assisted living and continuing care, as well as palliative care. And I also am a family caregiver to my father, who was injured after a motorcycle accident. As well, I am the dean of the largest school of nursing in the state of Oregon, and I have direct influence over the future nursing workforce. And we have not only chronic illness management, but we have palliative care, family caregiving, and all of those aspects of the importance of how health providers, and in particular nurses, need to be prepared in engaging with families as equal partners in their work. And so that brings us then to goal 2, which is one of the ones that I am so passionate about. And also just incredibly grateful to the team who has worked on this one in particular. So the priority area is the engagement of family caregivers as partners in healthcare and long-term care services and supports. So goal 2, and again, as Nancy stated, each of these priority areas and goals are equally as important. So we just we're trying to continue reiterating that component, that there isn't necessarily one priority area or goal that is more important than the others. But we may have our own passions about which ones we think that we are most drawn to. And this is definitely the one that I've been very passionate about. And the goal is that family caregivers are recognized, engaged, and supported as key partners with providers of healthcare and long-term services and supports. And with that introduction to the goal, I will turn it over to my dear colleague, Dr. Georges, and she will walk us through the actual recommendations. Catherine, are you can you check and make sure that you're unmuted?
Thank you, Dr. Shillum. And I agree with everything that you've just said, also being a nurse and running a nursing program in the city of New York. But particularly, I brought to this council my experience as a family caregiver, having cared for my husband who had Parkinson, and also at the same time representing AARP, the world's largest consumer group, where a hallmark program in AARP is family caregiving. So I'm really pleased that these recommendations, I met some of the most brilliant people who are council members with passion, in making sure this works. The recommendation 2.1, ensure the impact of policy and practices on family caregivers are studied and understood before changes are made in healthcare systems. 2.2, identify and include family caregivers as essential members and partners in the care recipient's care team. Recommendation 2.3, engage family caregivers through the use of evidence-supported and culturally sensitive family caregiver assessments to determine the willingness, ability, and needs of family caregivers to provide support. Next. Recommendation 2.4, increase the integration of care through the inclusion of family caregivers in all relevant care coordination and transitions across providers and settings, and when desired, by both caregiver and care recipient. Recommendation 2.5, strengthen the training of healthcare, social service, and allied professionals to maximize family caregiver engagement and referrals to services in the community.
Thank you so much, Dr. Georges. And I definitely see your influence and mine in these recommendations, as well as you mentioned, all of the amazing committee members who've worked on this specific goal. So our question is there anything that is missing, anything in this recommendation, the goal or the recommendations specifically, that you feel is missing, that we haven't captured with what we've put into all 5 of these specific recommendations?
Casey, this is Alan Stevens. I just want to commend the work of this subgroup and for your leadership, Dr. George's leadership. Very, very, very well done.
Thank you for, yes, and I absolutely appreciate Dr. George's leadership in this work too. One of the other questions that we considered asking is, we want to also make sure, and Greg sent this out in our most recent communication, is have we really captured does the language reflect the lifespan of caregivers, care recipients that we might be seeing as well? We wanted to also just ensure that we aren't focused on any one particular population or group with these recommendations, but rather that we're capturing the full scope of all family caregiving that happens in our nation. And so with that, I would also just like to ask, do you feel that we've captured that, and that we are really reflecting and representing the full scope and breadth of family caregivers?
Casey, this is Nancy. I think that's a global issue, and that, as our report is being written, Sarah and Greg, who are taking the lead on that the whole idea of lifespan needs to be woven throughout all of the writing, not necessarily with each and every recommendation, but it's global. It needs to be woven in throughout the report.
Yeah, really great point, Nancy. And from my review, I hadn't seen anything in particular that reflected that we weren't capturing that in either goal 1 or goal 2.
And yes, that is the focus that, you know, as we are crafting the report and pulling it together, we are being very, very mindful of the lifespan approach. And that will be, I think that'll be very evident in the draft that we will provide to you all relatively soon to begin reviewing.
Wonderful.
This is James Cheeley. I also noticed in the vignettes that Mike Whitkey put together, a couple of the people specifically pointed out caring for my family member for the rest of their life. And I think that's so key for their presentations as well.
Yeah, such an important point, James. And we really do appreciate it. Yes, Carol, go ahead.
Thank you. No, I had the same thought as James, and I think that's what's so important is that we're bringing the real life stories along with the recommendations so that people get that full picture.
Yes, I remember all of our conversations where we kept saying that we were hoping that we could have pictures of actual family caregivers to help reflect what their stories are. And now with this project, we're going to be able to have that.
It's going to be, I think it'll be very powerful on many levels and for many different audiences. So did we?
So given that I haven't any feedback that indicates that anyone feels that anything is missing, can I ask for us to move forward for the vote for goal 2?
And again, this is for our non-federal partners only. Chantal, can you move the slide forward, please?
Carol's shaking her head like she can't see the poll again.
Yes, the time's clicking, but I see it, so things are improving. Thank you.
Only James.
Okay, we will be closing the poll.
Great. Looks like we have unanimous +1. So that's good. That's good. So excellent. So we have recommendations adopted under goal 2. Now we had built in at this point. We're actually making very, very good progress. We had built in a little break at this point, assuming that we were going to be about 30 to 40 minutes later in our agenda. Do you all want to take a little break for 5 or 10 minutes now, or do you just want to keep on working because we could move right into goal 3?
Keep going.
Okay, and we will do that. So priority area goal 3, we will again hear from co-chairs Dr. Shillum and Dr. Stevens, and then from our subcommittee leads, Dr. Georges and James Cheeley. And so we've got quite a slate of recommendations under priority area 3. So co-chairs, I will let you all kick off this discussion.
Thank you, Greg. And so I will start us off with reviewing the larger goal here. And the priority area is for services and supports for family caregivers. And the goal reads, family caregiver have access to an array of flexible person and family-centered programs, supports, goods, and services that meet the diverse and dynamic needs of family caregivers and care recipients. And so I will turn it over to Dr. Georges and James to walk us through the specific recommendations.
James and I will use the format that Carol and the other James use. So James Cheerley, you can start.
Okay. Since everybody else has introduced themselves a little bit, I'll introduce myself as well. I'm basically a dad. I coordinate Special Olympics in our community, so that makes me dad to 62 or so athletes here in our area, and just means a lot to me to be involved in their lives. And as I introduced myself back in August of last year, I'm just waiting for everybody to call because they need some roofing work done at their house, and nobody's called yet. So I guess their roofs must be holding up pretty well. So recommendation 3.1 is to increase access to meaningful and cultural relevant information, services, and supports for family caregivers.
Recommendation 3.2, increase the availability of high quality, setting appropriate, and caregiver defined respite services to give caregivers a healthy and meaningful break from their responsibilities.
Recommendation 3.3, increase the availability of diverse counseling, training, peer support, and education opportunities for family caregivers, including evidence-informed interventions. Next slide, please.
Expand caregiver support programs and services that maintain the health and independence of families by increasing access to housing, safe living accommodations, food and transportation, and by reducing social isolation.
Recommendation 3.5, encourage use of technology solutions as a means of supporting family caregivers.
Recommendation 3.6, expand the use of vetted volunteers and volunteerism as a means of supporting family caregivers. Next.
Recommendation 3.7, improve the support of family caregivers during emergencies. Examples would be pandemics, natural and man-made disasters.
Recommendation 3.8, increase the prevalence and use of future planning as a means for ensuring family members have the needed supports in place throughout the care recipient's life.
Recommendation 3.9, increase and strengthen the paid long-term services and supports, LTSS, and direct support workforce. Next slide, please.
So that was it. There was 9 recommendations under that goal. So
right.
That's great.
Hi, this is Alan Stevens, and I'll entertain questions or comments, discussion of these recommendations.
So Alan, this is Carol Zernial. I just wanted to thank the committee for including the language for person and family-centered programs. I think it's so important to call both of those out because people will say, oh, we always mean person-centered or we always mean family-centered, but by explicitly saying it, it's very important.
I agree. Any other comments?
I just have to say, and I know we had a lot of discussion, but I think the criticality of recommendation 3.9 must be clearly defined, because there's so many people who have to have someone else besides a family member, and paid long-term care services and supporting the workforce are such critical issues as the population ages and needs change and family dynamics change.
I agree, and I would just add to that, and I think when we're reflecting back on the year that we've just been through, we can see how the pandemic has shaped our thinking. This is another one where we really have to think long and hard about how long-term services and supports would be provided.
Mm-hmm.
Okay. Any other comments? Okay. Greg, I'll turn it back to you.
Okay, I think if we can move to the next slide, and Cheryl, if you want to pull up the next poll. This is for, again, non-federal council members to vote on Goal 3 recommendations. Your time starts now. Okay, it looks like we have 15 plus, so that's good. And I bet you Carol was the first one that voted, right? Okay, congratulations, guys. You voted on Goal 3. Are we okay to move on to Goal 4?
Yes.
Okay, Nancy, take it away. Nancy, are you there?
I am, and I'm reading right to myself without unmuting myself. Okay, I'll start again. So priority area 4 is the financial and workplace security for family caregivers. And goal 4 reads, family caregivers' lifetime financial and employment security is protected and enhanced. James and Carol, do you want to read the recommendations, please?
Yeah, next slide, please. Carol, you want to start it off?
All right. So recommendation 4.1, decrease the negative financial impacts for family caregivers on both a short and a long-term basis.
And 4.2, advance the development and broad adoption of employee-centered flexible workplace policies and practices that support work-life balance and maintain performance when personal circumstances change.
Next slide. 4.3, increase the availability and use of financial education and planning tools for family caregivers.
And 4.4, improve the affordability of long-term services and supports and reduce out-of-pocket costs for families through public and private payers. Next slide.
So Nancy, I guess any discussion from any of the council members on any of these?
Yeah, I was just going to ask, does anyone have any significant changes to be made to any of these recommendations? looks like we did another great job coming up with them. Greg, I think we can take a vote.
All right, go for it. So we'll pull up the next poll.
Greg, this is Rhonda.
Yes.
And while we're taking this poll, I just want to congratulate everybody, but especially all of the support staff and the people who've done this, because we did a lot of nitpicking. These are really, really well done, and I applaud all those who've worked on this so hard. Thank you.
Thank you, and right back at every one of you. This has been truly a wonderful process. So, and it looks like we have a vote to adopt the recommendations under Goal 4. So, way to go. So we're really cooking along here. So I'm thinking we could probably jump to Goal 5 since there's only just a couple of recommendations under that one. And Alan, Dr. Stevens, do you want to go ahead and kick off Goal 5 discussion?
Sure. And this comes under the priority area of research, data, and evidence-informed practices. Just again, a little bit about myself. I've spent a career doing research in family caregiving, mostly around the area of dementia. And it's just been a great pleasure to work with this group who represent such a diverse and important reflection of caregiving. It's been just a pleasure, and I look forward to the work that we continue to do. Goal 5 stated, family caregivers are engaged stakeholders in a national research and data gathering infrastructure that documents their experiences, translates evidence into best practices, develops person and family-centered interventions, and measures progress towards the national family caregiver strategy. And the recommendations, I think, are going to be read by James.
Mr. Cheeley, are you there?
I'm here reading to myself like Nancy, taking after other people. I think the first 4 recommendations had such meat to them of what we really want to put into place. And this goal, these recommendations are the bones that are going to make it last forever, because it's going to put together the numbers that substantiate the work that we really want to do. And I know Alan seems like the research and numbers kind of guy, and he just kept us on task to get this part done the right way. So recommendation 5.1 is establish a national infrastructure using standardized data, questions, and a definition of family caregiver for obtaining, analyzing, and disseminating information about caregivers and their experiences. Recommendation 5.2, increase family caregiver research that facilitates the development and delivery of programs and services that support and enhance the health and well-being of the caregiver and care recipient. And recommendation 5.3, increase the promotion, translation, and dissemination of promising and evidence-supported practices to support family caregivers in the delivery of health care and long-term services and supports.
Thank you, James. Comments from the group about this set of recommendations or questions?
I just wanted to add my congratulations to this team. And James, I really appreciate that analogy that this is the way that this entire set of recommendations maintains sustainability. And it is with that active, engaged stakeholder approach that this is going to be able to continue on. So congratulations, this is really, really well developed.
This is Teresa. I just have a minor edit, a comma after obtaining.
In which one?
Oh, I'm sorry. 5.1.
Okay, all right. So we will make note of that copy edit. Yep. Thanks.
I echo what Casey said. This is Gisela with Home Instead, and that was beautifully framed up, James, and the work of this group across the board with all 5 goals. But I like the way you framed up the importance of the data and the sustainability. So thank you for that.
This is Carol Zernial. A researcher once told me that the research gives us new knowledge. And so to all the points in the prior recommendation, that it not only sustainable, but this keeps us fresh. It's new knowledge every time we grow and we create out of this data. And so thank you to this group for making that possible.
Thank you. Thank you for those great comments, and yes, so much good work across all of the goals and all of the recommendations. So I add my thanks to the committee, but also to Greg, the whole team there at ACL and Ashby. You guys have put up with a lot.
We love you guys. Okay, did we, Alan, do you think we were ready to move this one to a vote?
Yeah, I'll just add to the other co-chairs' previous statements that we strongly believe these are 5 well-integrated goals, that the recommendations weave together the fabric that we really need to understand caregiving. None of these are more important than the other, but collectively, I think they'll take us forward in a very positive.
Okay, and I see the poll for goal 5 recommendations is up, so non-federal members.
Non-federal council members.
Non-federal council members, thanks.
15.
Okay, and it looks like we had 15 of 15 vote yes to adopt them.
We finally got it right.
We did. We did, and I think in record time too, 36 seconds. Congratulations, you guys. May I just say, nice work. Thank you. It looks like we have a slate of recommendations that will be included now in the initial report to Congress. Anybody have any final thoughts or questions? I mean, we are really doing wonderfully in our time on this meeting, and so we don't have much after this, and so you all may actually get a couple hours of your day back, which will be great. But are there any last-minute thoughts?
Greg,
yes.
Greg, could somebody please send out the dates and times again for the listening sessions?
Yes, we will do that. We will do that for you.
Thank you.
Mm-hmm.
And Greg,
I just wanted to also add in, there were a couple of questions that were posed in the chat, and I didn't know if we would have a chance to be able to respond to those.
Sure. We do have time for that. So the first question was around, will there be any public relations efforts by this group to gain widespread support for the recommendations and increase awareness of the RAISE Act and the Council to caregiving advocacy group? For example, the person who posed this question mentioned that they receive emails from Caring Across Generations, and they recently mentioned that there are caregiving initiatives proposed by the President-elect Joe Biden. However, in skimming her emails, I didn't notice any mention of Ray's work on a national strategy. And she hopes that regardless of the administration, the caregiving advocacy groups will get behind your recommendations. And I would say that certainly that is our hope as well. I can tell you that this work has very much been done in full coordination with a number of the advocacy, quite a few of the advocacy groups related to family caregiving. So in addition to the incredible members of our Family Caregiving Advisory Council, the National Academy for State Health Policies project that's been funded by the John A. Hartford Foundation also has a faculty of advisors to their work, and they really do represent the who's who also in the of the family caregiving world, both from a research, practice, and advocacy policy perspective. So we do have that. As is typical with government-led activities such as this one, once the report gets ready to be released, there will be public outreach and messaging around the report. And then as we roll into the development of the National Caregiving Strategy, which will begin in earnest early next year, and we're going to go over some timelines here in just a minute, but all of that will be part of the messaging that we do. And as you can see with our Caregiver Month campaign this year, we're already starting to build awareness of our work because of where we are in terms of the progress. So today's meeting really did represent, in my mind, a very high watermark in terms of an accomplishment for this council. Certainly when we convened for the first time in August of 2019, I could not imagine this point now because we had so much work ahead of us at that point, but I see what you all have accomplished. And I think I speak on behalf of Lance Robertson when I say that you guys are absolutely amazing. And then the other question was, will the final report reflect the urgency for some categories of family caregivers, particularly those who have been providing care for many years and providing extensive care, all ADLs, for example? And can I express the need for immediate and retroactive financial supports for this category of family caregiver? And I can say thank you for that input. That is certainly something, all of the chat comments that are captured and saved, and that information will be made available to our council members as they begin working on the national strategy. And as we will take that comment that you made and look through where the report is to see if we can make sure that that's incorporated, because I do know that that is a key issue, is length of time and the financial impacts of family caregiving. So thank you for that comment.
Craig,
yeah. Yes.
Can I add a comment?
Sure.
I think if anybody, non-federal member, people at large that are associated with this chat today, if you looked across the board with people that are on this committee, when we gathered in August of 2019, everybody wanted to do something, to make a difference, to, I guess, get our hands dirty and accomplish something. And oftentimes people think of accomplish something as what's it going to do for me tomorrow, because we're an instant society. I have learned so much that without this type of a recommendation for where do we go and how do we get there, that nothing will ever change.
Right.
And I don't think there's anybody here that feels like there's still enough being done yet. But what we're doing is getting us to where we need to be to really get something done. So we know where all those questions and comments come from. Let's get something done. But boy, have we done so much already through so many intelligent people that have shared great information.
Yep. Hear, hear. Thank you for that.
Greg, this is Wendy
Yes.
Fox-Brage with the Raise Family Caregiving Resource and Dissemination Center. And so building on James's comments, I also just today want to acknowledge what an incredible milestone this is. That you voted in the recommendations that you've been working all so hard on for over a year. You've worked hard, you've worked diligently. What an amazing council. Really just incredible, lovely, lovely people you are. And it's just been an honor for me and for my colleagues, or the staffers who've been behind this, to work with all of you today and on this important work. So thank you to the council members. Thank you to the public who's listening in and who've been listening into our meetings, and the support, the incredible staff from Nashby, Greg and his whole team at ACL, the support of the John A. Hartford Foundation, Ronnie Snyder, Scott Bain, and really great jobs. Kudos to everyone. You did it. Yay.
And, and we are by no means done. We are literally just starting. So this is the first. We're winding up one chapter of your work, and we're looking ahead to the next chapter of your work, which I think is kind of a nice segue to wrap up with. If we can go to the next slide, I want to talk a little bit with you all about the next steps that we but when I say we, I mean ACL through Lance's leadership, but also in our collaboration with NASHP, we've begun to chart out some very immediate next steps that are going to be happening. And so I wanted to share that with you, the council members, but also for those members of the public who are listening in, so that you all have a sense of where things stand. So now that we have the recommendations voted and adopted, this gives us a very, very clear roadmap now for where we need to go with completing the drafting of the initial report to Congress. And so that work is going to continue through the rest of this month, and I can't believe we're more than halfway through the month of November already, and into the next month. We're also, as the designated federal official and the lead for this at ACL, will begin reviewing the report with key members of ACL's policy office, our front office staff, as well as sharing it around the agency with our various components at the Administration on Disabilities, the Center for Integrated Programs, our Office of Policy and Performance and Evaluation, to make sure that we're hitting the right themes and we haven't forgotten anything. And then, so that will take place through the months, what's left of November and into December, realizing that we have the holidays and all of that. There are no formal council activities scheduled for the month of December. I don't know about you guys, but we kind of needed a month off. So that's what we're going to do, but we're not taking a month off. We're going to encourage the council members to tune into the stakeholder listening sessions that will be part of NASHP's work. We will resend that invitation to you so that you can have that to tune into. And we may be in communication with you over various parts of the work that I talked about, finalizing the initial draft of the report. If you can go to the next slide. So then, as we look, here's a tentative schedule of what we're thinking about for meetings and related activities. Knowing that we have a lot to accomplish and we want to begin to get the report moving, we would like to convene you guys as a full council again in the month of January, and we'll send out a doodle poll for the dates, probably one of the 3 dates that we typically hold for subcommittee meetings, and we're going to have a very focused agenda for that meeting. We're going to look at NASHP will present the Medicaid paper that they wrote, which that Medicaid paper, like the Medicare one you heard a couple of months ago, will form an integral component of the initial report to Congress. We're also going to have, by that time, be able to review with you the federal inventory of federal programs and initiatives that support family caregivers. We want to show you where we are with that and what that looks like. And then we're going to have a report out from Community Catalyst on the listening sessions that take place in December, which will provide you as the council with a tremendous amount of information to begin carrying forward into your development of the strategy. And then what we're going to do at the end of that meeting is we're going to lay out a structure for you all to begin, as the council, your review of the initial report to Congress, because by that point we expect to have a draft ready for you to begin looking at. So that will be in a January full council meeting, a lot to cover then. In February, you'll go back to your subcommittee meeting, your subcommittees for meetings, and you'll, in your subcommittees, be able to walk through and really dig into sections of the report that you want to, can you go, thank you, want to focus on, and you'll prepare and provide feedback to ACL and NASHP on, as the council, what you know, your thoughts on the report, where we need to make some edits and changes, and really, again, looking for holes in anything that you'd like to have included. So that's February. And then in March, we're looking to have a full council meeting again, where we will do a final review and discussion of the report, and hopefully be able to take a vote from the non-federal members to move that initial report into the clearance process within HHS. I put tentative in italics because we're in a very changeable environment right now. As we see it right now, we think this is doable. As things progress over the next several weeks and next couple of months, we'll see where things where leadership is within ACL and how we can keep things moving. But this is our tentative work plan, and during the month of December, NASHP and ACL are going to put our collective heads together and come up with a 2021 work plan that will get us to completion of the drafting of the national strategy with you guys. And we're working on an approach that will really help facilitate that process for you guys to come up with the national strategy. So that's our thinking on December, January, February, and March. Any thoughts on what we've got laid out for you? Any questions?
Greg, if you just curious about the February timeline of reviewing and the report and stuff, which makes I want to ask the question: how lengthy will this report be?
So we are doing our absolute level best to keep it under 100 pages. Now so the way it's shaping up right now is that the section that deals with Medicare and Medicaid will be executive summaries of those two commissioned pieces, the Center for Medicare Advocacy and the NASHP Medicaid paper that just came out the other day again. So those will be heavily executive summaried within the body of the report, and then we will link out to the full documents. The same thing goes with the analysis of the RFI. We're heavily executive summarizing that. So it's probably longer than your typical executive summary, but we are bringing that together in a way that will hopefully provide concise picture of what the RFI looked like, and then we'll link out to it. And the same thing with the caregiver vignettes. And the national inventory. Because all of this will be posted online, it gives us some flexibility in terms of how we present the report for length, and so it may very well be that it's more easily digestible this way. Well, yeah, we're very mindful. We don't want to produce a tome, but yet we need to hit the high points, and we need to be responsive to what the RAISE Act calls for in the report, which I think will provide us with a very robust but also meaningful document as well.
So then, Greg, once we have the report, then how is it given to members of Congress?
So according to the statute, it has to be made available electronically. Depending on resources, we may be able to produce some hard copy, but that would be a decision a little bit down the road. But it will definitely all reside electronically and in accessible everything would be 508 compliant and completely accessible?
This is Helen Gray. I can comment on that from our Napa experience. So
Go for it.
our reports go through the Office of the Assistant Secretary for Legislation. After they're cleared, there are letters to Congress, and then they used to physically walk the reports up to the Hill. Now they just send them. And so our staff liaison at ASL knows the contact person for each of the relevant members and committee chairs, email addresses, and they send them directly to them and copy us on that. So it's not as nice as actually walking up a hard copy, but they get it very directly.
Thank you, Helen.
So if a senator wanted to have would protocol be that if a senator wanted to hold a hearing on the report, is that something that would happen or could happen?
Helen, is that, in your experience, is that something that could happen?
The Senate Aging Committee, Special Committee on Aging, has had hearings on Alzheimer's and dementia that have included components such as the national plan and the progress that we have made, but not wholly focused on just the plan and what's happening. They're not trying to. I'm trying to think of the committee that would, be like, why isn't this happening fast enough? Or why aren't you doing more? It's never been that sort of focus. It's been a while now, but most recently it was like the chair of the advisory council talking about general awareness of the issues and challenges, and then what the federal government is doing, and then other witnesses talking about their experiences. In this case, I'm thinking of as a caregiver and for someone who was a provider. Twice we had our principal deputy assistant secretary testify about what the federal government was doing and how we were responding to the recommendations of the advisory council and the challenges of dementia. But it was never just focused on this. So you could have a hearing, but I think it would be a little bit broader than just the report.
Thank you.
Sure. So
I'm sorry, Greg. Are we going to be allowed to send a copy of the report directly to our senators?
I believe that would be acceptable. Yes.
Thank you. Thank you.
I'll have to get some of these specific. I'm learning some of this by the seat of my pants, so I will have to. But I'm pretty sure that would be permissible.
And in the dementia and Alzheimer's space, sometimes advocacy groups have taken the recommendations and reformatted them or made them really pretty or picked one or two and used them for their advocacy days. So it's all in the public domain. There's no reason that you or any of the groups watching this meeting today couldn't do the same with these recommendations.
Exactly, right. Yeah, so these will be out in the public domain.
So I guess one last question.
Mm-hmm.
Does this fall under aging or health and human services?
So the RAISE Act, I'd have to go, I can't remember the cognizant committee that oversees it, but it would be that committee in Congress, whether it was on the Senate side, that would have jurisdiction over this. And so I don't believe it's strictly aging and or disability. It's more broad than that.
And the Senate Special Committee on Aging doesn't have, I don't believe, has appropriating authority.
Right, they do not.
So that's just a consideration.
Hi, Greg. This is Deb from Maui. Part of the most recent reauthorization of the Older Americans Act allowed for the extension of this advisory committee. So there is.
There's a little connection there. I think it was that. I think it was just limited to extending the pushing out the sunset for this, the same, and it did the same for the grandparent legislation as well. Yeah.
I had one thought.
Great. Go ahead, James.
Sure.
Thanks. Well, thanks to everybody participating. Non-council members, it's been great to see all the names of people joining. Thanks, Sharon Kavanaugh, for sharing your thoughts. And I just wanted to leave one sentiment for all of us going forward. And it's been brought up, and both like directly and indirectly responded to by recommendations, particularly in goal 3. But I just wanted to like share, you know, I like with, you know, it's on point, relevant to where we're going through right now. But you know, COVID's really like affected a lot of families and a lot of people who receive care, and part of what they're facing is some people are, there's been a caregiver shortage for, you know, a while now, and there's a growing caregiver shortage, but it's especially been problematic now for people who've not been able to get care. And you know, it's not something to address right here in this meeting, but for future meetings, both as council and subcommittees. I know we've discussed it before, but I just want to reiterate that it's worth considering, like both, you know, in the case of COVID and also just in the case of other, you know, natural disasters, like whether it be, you know, other pandemics, hopefully not, but also hurricanes, like, you know, tornadoes, things like that, forest fires. So giving that attention to shaping our ideas within the recommendations is just one sentiment I wanted to leave the meeting on.
Great. I think that's very timely. Somebody else was coming in with a comment?
Yeah, Greg's Alan. Just had to add another group that I think should be thanked in this discussion, and that's the people who helped get this legislation passed to begin with, who were the innovative, creative thinkers who managed to get legislation through both the House and the Senate at a time when that doesn't always happen that easily. So yeah. I don't even know who they all are. But I know there were a lot of people who did a lot of work and worked with congressional staff. So to those people who got the ball rolling, and to the legislative staff offices who helped, appreciate that.
Second that.
And it's the Senate, it's actually the cognizant committee in the Senate that has jurisdiction over RAISE is the Senate HELP Committee, which is the Health, Education, Labor, and Pensions Committee. So they would be the one, definitely the one committee who would be sent the report, but we would have the option to send it further than that.
Thanks, Greg.
Anything else for the good of the order today? This has been an amazingly productive and rather exciting meeting, but I don't want to cut the discussion off.
No, but we're past our break time.
That's true. So we may then we may as well just break and call it a day, right? So
might as well.
If there is nothing else, I want to just extend my sincerest thank you to each one of you on the council for where you have gotten us to this point. This is truly remarkable. We have so much to be thankful for this year, always, but this year in particular, and this is one of those things. So with that, I will say thank you to all of you. We will be in very close communication with the council members regarding the next steps that I laid out for you in terms of getting the January and the March meetings on the books, as well as keeping you in the loop as to where we are with the development of the draft report and when that's going to be coming your way. So if there is nothing else, we will end here with much gratitude and good wishes for a great holiday season.
Thank you, everyone.
Thank you. Happy Thanksgiving.
Oh, thank you.
Enjoy the holidays.
Thank you, Greg, and thank you to Nashby.
Thank you.
You all.
So.